Hello, this is Dr. Grande. Welcome to my video on the theory of behavior therapy. Behavior therapy is a fairly common modality that uses concepts like reinforcement and consequences to treat symptoms such as phobias and different types of anxiety, although it can be used for other symptoms as well. Let's start by taking a look at the theory of personality used in behavior therapy. So in behavior therapy, there are two types of conditioning: classical conditioning and operant conditioning. Classical conditioning has four major components. So let's start with the concept of the unconditioned stimulus. The unconditioned stimulus is a stimulus that causes a natural response. That is a response that was not learned. So I'll use the example of a common phobia, a fear of spiders. If an individual has a fear of spiders, and this fear was not learned, then the presence of a spider is an unconditioned stimulus, because it'll create an unconditioned response. And let's say, for example, the response is fear, including all the natural physiological responses you would expect to accompany fear. Then we move to the concept of the conditioned stimulus. So the conditioned stimulus is a stimulus that an individual does not have any natural reaction to. So let's use the example of a light flashing. So an individual sees a spider and they're fearful, and they see a light flashing and they have no reaction. For that light flashing to be considered a conditioned stimulus, there has to be a conditioned response. And the way that is developed would be if the light were to flash before a spider came into somebody's view, an individual that was fearful of spiders. So they would see the flash of light, then they would see the spider, then they would have the unconditioned response. If this pattern were to continue, if there was a flash of light and then the introduction of a spider, or a spider coming into their view, then the flashing of the light becomes a conditioned stimulus and fear becomes the conditioned response, because the light can be introduced and the fear will come about without the introduction of the spider eventually. If this process, this pairing, is repeated, the spider is no longer necessary to get the fear response. Now, operant conditioning is a bit different. It deals with the idea of behavior and consequences. An individual engages in a behavior, consequences occur, the individual reacts to those consequences by exhibiting the same behavior or another behavior, or not exhibiting a behavior related to the consequences at all, an avoidance. So we have a few key terms in operant conditioning. The first is positive reinforcement. And positive reinforcement is when a consequence increases the probability of a behavior. For example, say that a student studies hard for an exam and that student receives an A, and that A leads to that student studying hard in the future to try to do well academically. That's a positive reinforcer. Then we look at negative reinforcement. Now, negative reinforcement is different than punishment. Reinforcement always, whether it's positive or negative, always increases the probability of behavior. And in the case of negative reinforcement, an unpleasant stimulus is removed, and that increases the probability of behavior. So think of an alarm clock. Somebody's sleeping, the alarm clock goes off. Let's assume that it's a loud alarm clock and it's unpleasant. The sound is unpleasant, particularly for somebody who's just waking up because of it. And an individual reaches over and deactivates it. They've responded to a negative reinforcement process. The sound that the alarm clock made increased the probability of them getting up. Now, punishment is a different construct. It's a direct negative consequence to a behavior, and it's done with the intent of making that behavior less likely to occur. Unlike reinforcement, which increases the probability of behavior, punishment is designed to decrease the probability of behavior. And extinction is when a learned behavior is no longer exhibited. So using the example of the student that receives the good grades, and that helps encourage the student to continue on and work diligently to accomplish other good grades. If that positive reinforcement was removed, let's say the grades were no longer posted or available to the student, if that was a major motivator, then eventually the working diligently component would become extinct. That behavior would extinguish. Of the items listed here under operant conditioning, in behavior therapy we see positive reinforcement and extinction, and of course behavior and consequences are understood, but negative reinforcement and punishment aren't used. They're part of the theory of personality, but not part of the therapy. So moving on with the theory of personality, we'll take a look at social cognitive theory. Now, social cognitive theory goes a bit further than operant conditioning. It includes what we refer to as covert behaviors. These are behaviors that are hidden, that are difficult to observe, like thinking, feeling, or physiological responses. Under this theory, we have what's referred to as the triadic reciprocal interaction system. And under that system, the environment, personal factors, and behaviors are understood to interact with one another and affect each other. And cognitive structures are thought to regulate behaviors. Additionally, under this system, individuals learn through the observation of other individuals. Generalization is when response patterns expand to similar stimuli. So again, using the example of the student that is encouraged, that is reinforced by receiving A's, they may expand that response pattern to include positive feedback that's given to them by a teacher, by a parent, or by a classmate. Discrimination is the ability to react differently based on the introduction of different stimuli. And it occurs because some responses are reinforced and others are extinguished. Now, continuing with the theory of personality, we take a look at social cognitive theory. And unlike operant conditioning, social cognitive theory includes what we refer to as covert behaviors. These are behaviors that are difficult or impossible to observe, like thinking, feeling, and physiological responses. Under this theory, we also have the concept of triadic reciprocal interaction system. And this system takes into account the environment, personal factors, and behaviors. A few examples of personal factors would be preferences, beliefs, predictions, or memories. Also included in this system is the self system, and that is a set of cognitive structures that regulate behaviors. Part of the system includes that individuals will learn through the observation of others. Continuing with the theory of personality, we'll take a look at generalization. And this is when response patterns expand to similar stimuli. So using the example of the student that is positively reinforced by getting A's on exams, it's possible that student would also respond to positive feedback about academic accomplishments from a parent, a teacher, or classmates. Discrimination is the ability to react differently to different stimuli, and it occurs because some responses are reinforced and others are extinguished. So for example, an individual may act differently around somebody that they perceive has power, for example, a power to help them, than they would around somebody that they perceive does not have power to help them. Another part of the theory of personality in behavior therapy is the idea of self-efficacy. And achieving self-efficacy is thought to be a positive outcome, and there are 4 components related to achieving self-efficacy. First, we have performance accomplishments. And what this means is that past successes can lead to higher expectations, and that can lead to higher self-efficacy. Vicarious experiences also can affect self-efficacy. If an individual observes another individual and the observer believes that they can accomplish the same level of achievement as the person they're observing, that would lead to higher self-efficacy. If they were to believe they cannot achieve it, that would lead to lower self-efficacy. Verbal persuasion is positive feedback from individuals important in a person's life, for example, relatives and friends. And then the concept of decreasing emotional arousal, which is when strong anxiety is relieved, often through therapeutic techniques, and this leads to higher self-efficacy. So let's take a look at the cause of symptoms as understood by the theory of behavior therapy. So one cause of symptoms would be negative response patterns. So behavior and consequence patterns that lead to distress. Symptoms are also caused if unproductive behavior is reinforced or productive behavior is extinguished. Another key concept in behavior therapy is the idea of observational learning. So individuals will model the behaviors of others. And if that behavior that was modeled was unproductive, then they'll learn that unproductive behavior. So let's take a look at the techniques used by a behavior therapist. So first we have counter conditioning, and this is based on the concept of classical conditioning that I spoke about earlier. And counter conditioning is when an undesired behavior is paired with an incompatible behavior, with the idea that the unproductive or undesired behavior will be eliminated. Next we have positive reinforcement, and again I spoke about this earlier. It's part of the theory of personality, but it's also a technique. And positive reinforcement is when a stimulus is introduced after a behavior that will increase the probability of that behavior occurring again. And then we have extinction here as well under techniques. And extinction is when a behavior is discontinued after a reinforcer is removed. Then we have the technique of shaping, and this technique is a little more complicated. With shaping, a behavior therapist is aware of a maladaptive or undesired behavior and a desired behavior. But the movement from the maladaptive behavior to the desired behavior is done gradually by reinforcing approximations of the desired behavior. So instead of a reinforcement being provided only if the desired behavior is fully met, if the behavior is partially exhibited, the desired behavior is partially exhibited, then a reinforcement is provided. And over time, through shaping, it's hoped that an individual moves from the maladaptive behavior and arrives at the desired behavior. Next we have systematic desensitization. And this is a very specific therapeutic technique that's used for fears or intense anxiety around a specific object. The object of the fear can be a person, a situation, an event, an actual physical object, or generalized fears. This technique starts with teaching a client relaxation techniques that are thought to be in competition with the anxiety and eventually thought to replace the anxiety. And then an arrangement of the object that is a source of fear. And in this arrangement, the client and the counselor both work together to understand how the object relates to the causation of fears and create an ordering so that you have a position of the object that creates the least fear, and then a little bit more fear and a little bit more fear, all the way to intense fear. So using an example of a fear of spiders, say that you're trying to arrange this object for systematic desensitization. The lowest level fear might be thoughts about a spider. The next level might be being made aware that there is a picture of a spider in the room. The next level could be showing the individual that picture. And you keep moving through those levels until eventually you have an actual spider in the presence of the client, and of course that would be the highest level fear. Now, as with any technique, behavioral or otherwise, caution has to be exercised, particularly at these more intense levels, at the intense arrangements. And also, of course, you want to make sure there's no real danger. For example, if you're going to use a real spider, it couldn't be one that was dangerous. Next, we have the technique of imaginal flooding. With this technique, the object of the fear is never presented. So using the example of the spider, a spider would never be used. And actually, even a picture of a spider would not be used. But rather asking the client to imagine the spider at different levels of fear. So they might imagine a spider that's at a great distance from them, and that causes a certain level of distress, and that imagining of that spider at that distance is repeated and repeated until it no longer causes the distress, until the anxiety no longer occurs. And then the next level of distress is introduced. Say, instead of the spider being far away, the spider's 10 feet away. And imagining the spider being 10 feet away occurs until the anxiety is no longer present. This process is continued until the client can imagine the worst arrangement of that object of fear, in this case the spider, and not experience anxiety. The next technique we have is modeling. And just as modeling can be a cause of symptoms, as I mentioned earlier, modeling can also lessen symptoms. So with this technique, the counselor models behavior that's productive for the client, that works toward the client's goals. The next technique we usually see in highly structured therapeutic environments, as opposed to individual counseling, like outpatient counseling. And the technique of a token economy involves establishing an environment in which desired behaviors are reinforced with a token, so it's a conditioned reinforcer. And when the client gathers enough tokens, that can be exchanged for an item that they want. And the item that they want is referred to as a backup reinforcer. So the token is a conditioned reinforcer, and the item that the client wants is the backup reinforcer. The next technique is the use of the Premack principle. And under the Premack principle, a high probability behavior is used to increase the frequency of a low probability behavior. In this model, the high probability behavior serves as a reinforcer. So say that a student comes to therapy and they are having difficulty studying, having difficulty setting time aside to study. The way the application of the PREMAC principle may look is the counselor would search for a high probability behavior. So we know that the studying is a low probability behavior. The client does not want to engage in studying, and that's why they are seeking counseling. So the counselor works to identify a high probability behavior. Let's say in this case, the client enjoys playing video games. So under the PREMAC principle, a system is set up where, say, the student studies for 20 minutes, and after that, they can play the video game for 20 minutes. So the low probability behavior is engaged in first, and then after it's complete, the client can engage in the high probability behavior. Next, we have the in vivo techniques, and they can be divided into two categories, graduated and intense. In the graduated type, the client moves toward the object of fear, or the feared stimuli, gradually. In the intense type, the client would experience the object of fear all at once. So in this type in particular, in the intense type, a strong reaction would be expected. So again, particular caution would need to be exercised when using this technique. And the last technique we have here is virtual reality. And this is when a counselor uses a computer-generated environment, and there are a wide variety of those available, to expose clients to different levels of a stimulus. This technique has several advantages, but it's also quite expensive. Now moving on to the goals in behavior therapy. In behavior therapy, the goals are target behaviors set by the client and the counselor collaboratively. So the client and the counselor work these goals out together. They are specific and measurable, and the target behaviors are identified in part based on an analysis of antecedents and consequences. And when a potential target behavior is identified as a goal, the counselor explores the advantages and disadvantages of that goal with the client. Another general goal of behavior therapy is self-efficacy. Then moving on to my opinion of behavior therapy, and specifically how it can be integrated into a counseling style. Well, there are a lot of aspects that I like about behavior therapy, and that can partially be due to the fact that I like cognitive behavioral therapy in general and tend to use it quite a bit in practice. The concepts of reinforcement and modeling are not specific to only behavior therapy. A lot of different counseling therapies use reinforcement and modeling, even if it's not expressly stated in the theory. For example, if a client tells a counselor about something that the client achieved that's positive in the client's life, and the counselor responds with a positive and encouraging statement, that's reinforcement. They're using reinforcement even if they don't intend to. And that reinforcement can be very helpful to the client. I think it's important in general to have a good understanding of how reinforcement is at work in the daily lives of clients. Whether a symptom can be treated with reinforcement or not is a separate issue from understanding what reinforcement exists in the client's reality. Now, the concept of modeling is also used in other counseling theories, sometimes unintentionally, but as counselors, it's not unusual to model what we believe are helpful behaviors, and this does have an impact on clients. Again, it may not be what we're necessarily trying to do. We might not be trying to use a modeling technique, but by acting as a positive model, there is an effect on clients oftentimes. Another aspect of behavior therapy I like is the way that behavior therapists approach goals, meaning goals are specific and measurable. And clearly, some goals in counseling are not going to be specific and measurable, and that's okay. But I do believe it's important, when possible, to make goals specific and measurable. When that is an option, I think that is a good direction to go. I believe that this makes treatment planning more precise and more effective, and it also allows a counselor and a client to figure out when a goal has been accomplished. Just as with many theories of counseling, there are some behavior therapies that are highly structured. And although highly structured treatment isn't always the most ideal treatment, it does have advantages in certain settings. And I believe there's a lot that counselors can learn from studying how behavior therapists have arranged these highly structured treatments. And the last item I have here is phobias. Behavior therapy works for a few different types of symptoms. However, it seems particularly effective when applying it to phobias and some types of anxiety. And I see this as a real strength of behavior therapy. And I also see this as an area that can be integrated into a counseling style. Because even if a client has a set of goals and treating a phobia is not one of the goals, a fear can be discovered later on in therapy, and a behavioral technique or several techniques can be used at that time to treat that specific fear. Now, as for some of the weaknesses or challenges we see with behavior therapy, at times this particular modality can appear a little cold and not particularly empathetic. And I think that counselors, when integrating behavioral techniques, have to make sure to prioritize empathy, authenticity, and unconditional positive regard, which of course are used in person-centered therapy, so that the behavior therapy doesn't seem too distant, so the therapeutic process doesn't become distant, remote. This is also a risk when using the highly structured treatments that I discussed a few moments ago. And again, although there are advantages to highly structured treatments, counselors must continue to work to build the therapeutic alliance. So to summarize, behavioral therapy offers us a lot of different techniques that can be integrated into a counseling style. It appears particularly effective for phobias and some types of anxiety, but it can be used for other symptoms as well. And it is important to continue to build the therapeutic alliance when using behavior techniques. I hope you found this video on the theory of behavior therapy to be useful. As always, if you have any questions or concerns, feel free to contact me. I'll be happy to assist you.